Transfer services is important to a patient because it provides clinical safety first and foremost. Patients sometimes are in a very critical state and they're in a hospital that cannot care for them for one reason or another. So it can literally be life or death for a patient, and we see that quite often.
The challenges that we were facing when we initially set out on this project were prolonged transfer times. Physician satisfaction is very important in our role. Make sure that they're engaged and they're getting the service that they expect and that they deserve.
What we could pull from data, it showed that we were losing greater than 500 patients per month through leakage and through the inability to get them into the system when we were sought out for help. And when you look at our contribution margin per patient and you do that math, it's a quick $40 million in a year if you don't do anything.
So Central Logic allows us to extend in a way that a digital business would extend over greater states to bring that business down into us. And as we're able to capture that business and those patients who need that care and access to that care faster, we're able to utilize assets that would be underutilized at a time period when value-based care may make it even more challenging to survive, thrive, or even furthermore grow.
I believe what our senior leadership team is wanting out of our transfer center is what's best for patient care. And what's best for patient care is short transfer times and getting the patient to the right level of care as quickly as possible.
Our goals with this project, we believe we can get our transfer times down under 30 minutes.
Banner Transfer Services, this is Christina.
It's really put focus on us, and it's helped us unearth a multitude of opportunities that we didn't even realize were opportunities until then. The financial impact of these patient admissions, with looking at our partnership with Central Logic, we broke even on our first year payment in 31 days, and we broke even on our total contract cost in 152. Fantastic results.
What Central Logic has done and this partnership, it's allowed us to gain a better understanding of how diverse our healthcare organization is. What opportunities do we have to really look to standardize across the entire healthcare system, no matter where you're going to receive your care?
What's really interesting with that is in our early discoveries, when we take those tools and resources and we compare the antiquated bed boards that we had of yesterday with the bed board accuracy and Central Logic detail that we have of today, to find those nuances of available care spots, it can add up to nearly one missing hospital per day across our system. When you think about that kind of utilization and that kind of opportunity with the existing staffing structure, you're really talking about changing gross margin, talking about the number of lives you can impact, and talking about true efficiency gain without rebuilding or redesigning anything.